Hello and a very warm welcome to another mini lecture of Professional English for Medicine. The topic of today is Nurses. Part 1, Nursing Grades. Nurses working in the hospital have usually the following grades. Grade 1, Student Nurse. It is a nurse who is still in training. And Grade 2, Staff Nurse, is a nurse who has completed the training course. Grade 3, Charge Nurse, is a more experienced nurse who's in charge of or responsible for a ward or department. And Grade 4, Nurse Manager, is a nurse who is in charge of several wards. So Dr. James is talking to Sister Watkins. The old term sister is still sometimes used for a female charge. A female nurse manager may be called matron. Part 2, Support Workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerks, whose duties include making sure patients' notes and information are up to date and answering telephone. Part 3, Specialization. Like doctors, nurses can specialize in a midwife, a district nurse, and a health visitor. A midwife had specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. A district nurse visits patients in their homes. A health visitor also works in the community, giving advice on the promotion of health and the prevention of illness. Part 4, The Nurse's Role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. And here's the article. Nurses carry out surgery in effort to cut patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonia University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Let's take a look at some examples. Perform and carry out an examination, an operation, a procedure, an experiment, a test, and a biopsy. Other examples are: the procedure was performed, the procedure was carried out by a nurse. Do you know how to use the 2 words? Okay, we're going to talk about next topic until next time. Bye for now.